I feel everything is natural, like your teeth, because it's very thin layer.
Yes.
And it's custom made for you, for your teeth.
Okay.
And there's no difference between these veneers and your natural teeth.
Yes, but the material itself, of course, is
the material
different.
itself.
But the shape is the same.
The shape, according to you, if you want to make your teeth big, or if you want to make it small, if you close the spaces like this.
This is how
it has, it has a lot of uses as a veneer. Like, for example, but let's take it step by step. You said, can we actually have that Hollywood smile? I think if you're like fit as a patient, as in like you have enough tooth structure, you have enough enamel tooth structure. As I told you, the
what do you mean
outer
enamel? I got the first one.
Yeah.
The second one.
As in like the most outer surface of the tooth structure itself. If you have enough, because in order for you to place a veneer or even do bleaching, you need to have enough thickness of this enamel layer, or else bleaching won't work. Bleaching would kill you, because not kill you literally, but it will be
you will lose your teeth.
Yeah, it will kill you. It will be very painful for you, because like as I told you, like the second layer is the vital layer. It directly communicates with the pulpal tissues. So in this case, if you don't have enough tooth structure, you won't be able to do a veneer. You won't be able to do a bleaching itself.
So what you mean it's for a bit younger people rather than a bit older people who might have lost a lot of their teeth, and the teeth from bleaching or whatever are thinner?
Still, we don't want to piss the elderly off.
Yes, I know, but I just want to get them other solutions.
Actually, yeah, mostly you find but at the same time you do find, mashallah, very old people that still do have enough tooth structure that are still fit for
How
such
can this be maintained? I now, whenever I meet someone, they are having disasters when it comes to their teeth, restorations, lots of things. I mean, lots of problems when it comes to teeth. And people in their, I know people in their 40s or early 50s, and they've lost half
all their teeth. Yeah,
almost all, but half of it is not there.
Well, to be honest with you, there's unfortunately, a lot of malpractice within the dental field itself, if I can say that. That's why you need to be very careful with which doctor to go to, which doctor to trust with your teeth, because I think it's a very serious issue.
We've been talking about this at the beginning of the episode before you joined us, and we've been, I asked Dr. Bushra about how can I know if this cosmetic dentist is really good for me, and shall I trust or not? And we ended up saying that there's risk.
There is risk. There's always risk in everything. Yeah, true. But still, you know, it depends so much on the reputation, on your personal judgment when you go to the dentist. And
are you convinced or not?
Exactly.
Do you trust him or her or not?
Exactly. And you have to. As a patient, it's your right to see previous cases. I believe that every respectable dentist would have records of his work.
Sometimes having or just watching photographs or photos doesn't really give me, like, I don't feel relieved because they might be from the internet or whatever. I don't trust it.
You know, there are some doctors I've actually worked with hand to hand. They would, you know what they would do? They would perform surgeries. Like one of them was an orthodontic surgeon. What he does is simply recalls one of his old patients in order to talk to a patient who is about to go through the same procedure.
This is a way I could be convinced with.
This is, and I've noticed it. It convinces patients very much, because you know you're talking to a person who went through
the
same experience as yours.
Yes.
So this would be one thing you could easily demand. As a patient, the problem here is that actually all around, I believe, as a patient we don't know our rights. so we don't know how to speak to our doctor, and we easily just simply agree on everything he would like discuss with us or give us. He doesn't, some doctors don't even give you options of treatment. Any treatment or any problem has different alternatives. As a patient, you have the right to know all those alternatives and be convinced, and then after that you get to choose
You
one.
decide what you want to.
Exactly.
And I guess this is our role. That's what we're trying to do, to let people more aware about their rights, about the options, about different solutions. As we've been just talking, you told me you don't want to make the old people angry, but it's that I want them to have options. I want to give them all the information, and then they would decide, so that they become knowledgeable enough when they go and visit a doctor, a dentist, any physician. All the time when I'm talking about a medical topic, that's what I try to do, so that you have enough information to be negotiating with your doctor. It's not because you don't trust him or her. We do respect them a lot, but it's because you want the best thing for yourself, which differs from me to you to other people.
Exactly.
We are having a report, and we'll be back. We're talking about the beautiful smile. If you want to have it, if you want to be more confident, if you want to take years of your age, this is an episode for you. Please stay tuned.